Hello and welcome. My name is Jennifer Raye, and in this video I'm going to cover the liver meridian and the gallbladder meridian according to traditional Chinese medicine. So in this video here, I'll cover mostly the location and some acupressure points that you can use, but do make sure to check out the accompanying blog post that's linked along with this video, where you'll find more information about the organ systems, the acupressure points, and potentially how you could use these meridians in your yoga practice. Within traditional Chinese medicine, each of the organ systems have a yin or a yang pair. So the liver is considered the yin organ and channel, and the gallbladder is considered the yang organ and channel. And together, these two organs have a very specific set of relationships among them. Now, before I talk about the location of the meridians, it's important to mention that today I'll just indicate on one side of my body, but these primary channels do exist on both sides of the body, so keep that in mind. The liver channel begins on the inside edge of the big toe. And then from there, it travels through the webbing between the big toe and the second toe, and it travels along the top of the foot, on the outside of the inner ankle, and then it travels all the way up the inner leg. Now, there are three yin meridians of the inner leg: the spleen, liver, and kidney. And the liver channel is the outermost yin channel. So it runs all the way up the inner leg, through the inner knee, up through the inner thigh, and then it encircles the genitals where it enters into the pelvis. From there, it connects internally to a number of different organ systems, including the physical organ of the liver and the gallbladder. It travels internally and then eventually kind of zigzags across the side of the torso. And eventually it ends at the 6th intercostal space of the ribs. Now, there are a number of wonderful acupressure and acupuncture points on the liver channel. Today I'll just mention Taichung, which is liver 3, and that point exists in the dip, in the webbing between the big toe and the second toe. Many people find a little bit of a tender spot there. Now, liver 3 is really helpful to move liver stagnation. So especially issues with the eyes or the head, issues maybe of headaches, or also issues of menstrual irregularity, some level of stagnation or stuckness in the body can usually be benefited by using liver 3. Now, the paired organ to the liver is the gallbladder. And so the gallbladder channel begins near the outer eye, and then it travels to just in front of the ear. From there, it travels up to the hairline, and then it basically does a zigzag across the side of the head. Eventually, it travels down the side of the neck, and it travels along the side of the body, again in kind of various points along the side of the torso. Eventually, it travels all the way down the lateral aspect of the leg, so the side of the leg where the IT band is located. Okay, all the way down the side of the leg, where it comes out eventually to the top of the foot, where it travels to the space between the pinky toe and the 4th toe. Eventually, it ends on the outside corner of the 4th toe. There are a number of wonderful points on the gallbladder channel. Today, I'll mention gallbladder 34, which is a very common acupressure and acupuncture point. Gallbladder 34 is found if you take one thumb width and you go one thumb width below, so inferior, and one thumb width forward from or anterior to the head of the fibula. Okay, so inferior and anterior to the head of the fibula. Right there you'll find gallbladder 34. And gallbladder 34 is helpful to benefit the tendons and the sinews in the body. So if there's issues of maybe stuckness, tightness, pain, some issue around the tendons and the sinews, this can be a helpful point to work with. Now, of course, we can work with these channels in our movement practice as well. One of my favorite ways of working with the gallbladder channel is doing a lot of side body work. So releasing the IT band, really releasing this whole lateral sheathing that lies on the side of the leg and torso can be particularly helpful. If you want to learn a little bit more, make sure to check out the blog post, and I've included a little bit more information around the energetics and around the location of the meridians. Do make sure to get over to jenniferraye.com, and from there you can sign up for my mailing list, and that way I'll be able to continue to send you some resources around this idea of combining yoga and Chinese medicine. You may also be interested in some of my courses, which you can find at jenniferrayecourses.com. Thank you so much for watching, and I will speak to you very soon.